doctors generally don't know that. So partnering with these companies to really create a comprehensive model to change people's behaviors, I feel like is where we're headed. And to me, that's extremely exciting.
Hey guys, I know that you guys have been valuing in what we've been doing here at Health Rewired, and I know that the work that we've done so far is super valuable to be able to change the way that you think about your mind, your relationship to yourself, your health, and you're rewiring all of that. And what I wanted to do is I wanted to bring someone on for you from a different vantage point, from a different aspect of the world you'll hear his message is so clear, so concise, so beautiful in helping people get healthy from the physical and the behavioral and the mental side. And his name is Dr. David Geier. And Dr. David and I have recently become acquaintances, and we're becoming friends here. But I asked him to be on here for you guys to be able to understand what health means, what it looks like from the medical perspective, right? Because you guys see here from me all the time, as you guys, well, he's a chiropractor, he's alternative health and thinking, and it's just different, it's holistic. But you know what I want to share with you guys is that, you know, I'm not one of those doctors that says, well, medicine's bad and chiropractic is good, or alternative. Like, that's not it. The whole game is you need all of it. Every piece of the component is what's going to help you get better. If you break your ankle, don't come to me. Like, I don't know what to do with it. Don't go to a chiro. Go see Dr. David. That's what you got to do, right? So you've got to use every facet that's available. If it didn't serve, it wouldn't exist. Remember that. So Dr. David Geier is a double board medical certified orthopedic surgeon and sports medicine specialist and media medical expert. He started his own practice after spending 8 years as director of the MUSC Sports Medicine at Medical University of South Carolina. He holds a board certification from the American Board of Orthopedic Surgery in orthopedic surgery, as well as subspecialty in certification in orthopedic sports management. Currently, Dr. David serves as the Community Council Chair for the American Orthopedic Society and Sports Medicine Directors, also serves as the Chairman of Publications Committee for the American Orthopedic Society for Sports Medicine. He serves on the Medical Aspects of Sports Committee for South Carolina Medical Association, and previously served as the Chairman of Public Relations Committee of AOSSM and in the Outreach Committee for the Stop Sports Injuries Campaign. As you can see, Dr. David is no shortcomings to his accolades, and it's a really special guest for us to have him here. Dr. David, thanks for being here.
Oh, I appreciate it. No, that was really generous, and I'm not really as exciting as I would say have all the accolades as that makes it sound, but very, very excited to do this. You and I have so much in common, and I'm really happy to be here.
Oh, thanks, Doc. So let's just cut right to it, right? Like, you and I, we had a great chat and great conversation and our mutual relationships and that. And like, let's just talk about patient care from the perspective of taking care of people. Where are people today with respect to their health versus 20 years ago? What do you see in practice, clinical day-to-day practice as an orthopedic surgeon?
I'm actually seeing it go in two different directions. I'm seeing it sort of polarize in a lot of ways. I feel that there's a huge percentage of the population that has become really invested in their health. Largely people that you and I have similar audiences, people that care about what they put in their body and what they exercise, and dealing with aches and pains and preventative health strategies so they live longer and feel better. But then I feel that we're also seeing an explosion in obesity and an explosion in chronic pain because they're not exercising. And unfortunately, it's getting more and more. There aren't as many people in the middle. Either you got the people eating fast food all the time and just not taking care of themselves, and the people that really do. And that's a really tough divide, because all of the information that we put out there about nutrition, about exercise, about healthy living, both groups know it, but only one group is taking action on it. And so the key in my mind is figuring out how to get that other side to sort of join this movement to take control of your health.
It's interesting that you're saying that, right? Like, with the aspects of prevention, what do you think, like, in your experience as an orthopedic surgeon, you see a lot of athletes, but you also see a lot of people with broken hips and just elderly too, I would think, right? And you can correct me if I'm wrong, but like, what do you think is the factor that's preventing people to move towards preventative care?
It's really tricky. And I firmly believe that information is not the issue. We all know not to eat fast food. We all know we need to get exercise. We need to not smoke, cut down on our drinking, and all of the different things. And the key is, because everybody knows it, but very few people are doing it. And so in my mind, this is where the mental and the behavioral side comes in, about educating people, not just on giving them the information, but how they can incorporate these strategies in their lives. The problem that we have in the medical world right now, and anybody that's been to the doctor in the last 5 years can attest to this, is that doctors and all healthcare practitioners are seeing more people in less time than ever before. And so a comprehensive, this is how to start exercising, this is a healthy diet, and how you can take the slow steps to make it a lifelong habit. That's just not happening. And so if you just tell people, hey, you need to lose weight, they don't necessarily know how to do it. They may generally know conceptually how they need to do it, but they don't know step 1, step 2, step 3. And so the big challenge out there is getting the healthcare community getting some strategy where we become more educational in setting up these behavioral habits. And that's really tricky with the way the healthcare insurance model is set up today, but it's critical to the health of individuals, to the health of the country.
I completely agree with you, Doc. And let me just, I want people to hear this from, I'll say it, but I want you to say if I'm right or wrong. It's difficult for a doctor, a medical doctor, to be able to give the type of care that you want to. I've talked to many medical doctors around this. It's so difficult because you're governed at some level by the insurance companies, because they'll dictate what it'll approve for a patient's care. Like they can't get this testing, or you can't get this types of procedures that you know what's best for the patient, but it's not approved and they won't pay for it, and you kind of get handicapped. Am I correct in saying that?
It's absolutely true. And it's not just treatments. I mean, a lot of what I do is still considered experimental, even though there's good research behind it, but they just don't want to pay for it. But it's not even just that. It's certain tests. I was just talking a little while ago with somebody about hormone panels, and he basically was having to pay out of pocket because it wasn't covered by his insurance because he's in his 40s. And that gets really tricky in terms of you're essentially being told what to do. So there's the insurance dictating it, but it's also the way that medicine is now reimbursed. You know, you're basically having to see so many patients in so little time. How can you cover all of these aspects when you've got 30 patients, or in the world of orthopedics, sometimes it's 50 or 60 patients a day, at least the way I used to practice. That's really hard to have a meaningful conversation about things that are going to help them make changes in their lives. And so I really feel like that's a limitation of the healthcare system, but where that's allowed people that, like you and me and so many others, whether it's social media or just out there as health coaches, where we do have time to spend with people and fixing a lot of these problems. And so that's where you're seeing a little bit of a shift in how healthcare is delivered. It's not just the white coat lab doctors anymore, white lab coats, that are doing everything because they just can't.
It's interesting that you're saying that, right, Doc? So let me take this a step further, because I want people to hear it from you, not me, right? Has insurance reimbursement gone down or up in the last 3 years?
For most things, it has gone down. Now, they have tried to, CMS has tried to increase it for primary care doctors, because generally what is rewarded in terms of reimbursements are, I hate to say this, but they're surgeries. That's why so many people out of medical school become surgeons, because if you look at orthopedic surgery, you make almost nothing in clinic. That clinic visit is worth very few RVUs. What makes money, what gets reimbursed and gets you the RVUs, which is how doctors generally are paid in this country, how many RVUs a month you do, it's surgeries. And so they have tried to balance that out by making some preventative care. And if you take care of lots of different problems in an office visit, like the internal medicine doctors do, they've tried to bump that up, but it's still not enough, because these, practices by and large now are hospital employed, and there's just such a drive on these physicians to see more patients in less time, how can you cover 7 or 8 different problems and certainly educational strategies? Yes, you may get a small bump in your RVU if you talk about body mass index and things like that, but how much time do you really have to do that? So the system is less than ideal. They're trying to tweak it, but it's going to take a lot more than that, where the primary care physicians especially have the time to really make a difference and teach people educational strategies.
It's so important to hear, because I want everyone here to, because doctors get the brunt of it. I remember being in practice, it's like when you provide a service and the insurance company doesn't cover it, and they said they were going to even cover it. I mean, the doctor's office gets reamed up. But I want you guys just to hear this just for a second. Not from me, like I'm not in practice anymore, but here's a good physician, a great physician, as you can see by his accolades, but he's making less money, but he's got more seniority. Now I want you to ask yourself the question, if you kept on working in the same job you're doing and your expenses went up because of inflation every year, your expenses went up because your real estate goes up, everything goes up, but make less money doing what it is you're doing. How do you substantiate the cost of living? You have to see more people, and you can't give them the type of care. This is just basic economics. You can't give them the quality of the care that you want to because you're forced. And unless you own the practice or you own that, but if you're trying to be the one giving the patient care, you've got a quota to hit. I'll give you an example. I remember I'm going back 13 years ago when my son was born, and I don't know if you've ever experienced this, Doc, but I was randomly just kind of walking through the hospital, and I found this chart. It was really weird that I found this chart, but it was in this like crevice by the cafeteria of the hospital or the boardroom or something like that. I don't remember exactly, but it had the diagnostic procedure, the quotas, and what was actually achieved inside of it. And if they didn't, it was really interesting to see that. Now, I have no offense to that because it's a business, and I get that, and I understand that, and that's kind of needed in a business operation. But I want everyone to understand here, because we've got this huge challenge in this country where people don't realize the heart of a doctor, what they got to go through to become a doctor, to help people, to serve people, and they're the ones getting beaten. And I don't think it's fair because people don't understand the economics of it. So, I just want to say kudos to you for still being in practice and doing what you're doing, because it's not easy. I used to get so frustrated with it. So I just want to say thank you for doing that, number one.
Oh, I appreciate that. But that is largely, not completely, but it is at least largely why I've pivoted my practice in the last year. And now I'm in a cash-based system, and it also opens up, when you don't have to take insurance, it opens up the ability to do treatments that you just can't do in traditional practice, peptides and a variety of other things that have a lot of benefits, very safe, but insurance companies are like, no, that's experimental, and they just won't pay for it. My feeling is if you can use treatments that keep people from needing knee and hip replacements, that's a good thing. Why are we promoting surgeries, which, yeah, there are some benefits to the surgeries, but there's also a lot of downsides that you don't hear about, when we can potentially prevent it? And I think we're going to see a shift in all of this, but medicine in this country at least evolves very slowly. And I'm afraid that this shift to more preventative care, to treatments that hopefully can reverse damage, reverse illness, and get the body back to the way it was, I feel like that's still going to be a long time in coming. And that's really sad, because I feel like there's so many people out there that really would benefit, not by putting metal and plastic in their body or a coronary bypass surgery once they've had a heart attack, but doing things that potentially reverse that disease. And I feel like that's where we need to be going. And so almost, at least I had to sort of get out of the traditional system to start doing that in the orthopedic world.
Tell us a little bit about what you're doing, because some of the stuff you're doing, like I'm familiar with it, I know about it, but it's really cool, innovative stuff. Like, it's cutting edge. Like, share some of the stuff with the peptides, the exosomes, the stem cell stuff that you're working on right now. It's really powerful stuff.
Yeah, so I still do. I mean, I'm still double board certified, so I will still talk to people with, whether it's arthritis or a hamstring pull or just, shoulder injury or whatever it is, things like physical therapy, injections, even though I am completely or almost completely opposed to cortisone. I think that's one of the short-term benefit, but much greater long-term risks. I'm not a cortisone fan. And I'll still talk about surgery, but I'm really trying to get away as much as I can from surgery. And when people think of some of these experimental treatments, they think of stem cells, and stem cells are okay. There's some challenges with stem cells here in the United States where I don't think they're all that effective. But yeah, so we do some regenerative treatments, exosomes and PRP, which people know pretty well, platelet-rich plasma. But then the one that I'm really excited about are peptides. These are, as you know, short chains of amino acids that we make in our bodies. We've identified about 7,000 in the human body, and they all have different functions throughout the body. And there's a few specifically for bone and joint pain: BPC 157, thymosin beta 4, thymosin alpha 1, CJC 1295, that have really good effects in helping muscles and tendons heal, help to thicken cartilage inside of joints, help to decrease bone and joint pain. Completely safe. That you could take a whole bottle of it and you wouldn't overdose. It's just that that's really expensive. But the insurance companies call it experimental, and the FDA still calls these experimental. Now, the conspiracy theorists in the integrative medicine world will tell you that they call it experimental because the big pharmaceutical companies, the Pfizers and the Mercks of the world, want to sell these for $300 a pill at CVS or Walgreens, which may or may not be true. But I've had real good luck with some of those exosomes, which are sort of like stem cells, but they don't require a surgical procedure to harvest them from your body. They're basically taken from, at least the way we do it, we don't harvest them, but we use a company that gets them from amniotic fluid. And that sounds worse than it actually is, but it's got basically the internal components of the stem cells, but in much, much higher concentrations than the handful of stem cells you get from a bone marrow harvest. Because in the United States, you can't culture stem cells like you can in Europe or lots of countries. So stem cells, you're not really getting that many regenerative cells. But with exosomes, you're getting all of those functions of the stem cells, but in much, much greater quantities without a surgery first. And so we're using that on arthritis and a number of healing things. So it's a lot like that. And it's not always medications or injections. We use things like we're about to get a hyperbaric oxygen chamber for muscle and tendon injuries. That's being built in our office right now. Shockwave treatments that are very good. In fact, I use it on myself pretty much every day for all my aches and pains. So there's a lot of things that we try to hopefully get you better without needing surgery, but not just make you feel better, actually reverse the damage to get your body the way it was before you got hurt. Replacing, I know this is a long-winded answer, but if you can get something to be the way it was before it got hurt rather than making a new one or replacing it with metal and plastic, that's always a good thing to try. And so I think we're headed towards that. My son is starting biomedical engineering at Clemson, and I told him that he's the future of orthopedics, not the surgeons, even though you'll still need surgeons to put this stuff in, but it's the ability to regenerate a lot of these structures and make the body the way it was when it was healthy. That's the future of orthopedics.
I couldn't agree with you more. I think there's a lot of power inside that. And I love that you were saying that. So you said that exosomes is valuable for people who have arthritis and that. So if someone's in their 40s or 30s and we all know the people say arthritis is normal. I don't really consider it normal, but it's just kind of what society has deemed to say normal. But when does someone start saying, hey, look, I should probably consider doing exosome therapy for myself just as a preventative measure?
I have two perspectives on that. But before that, you talk about arthritis, and that's normal. And it does tend to happen as you get older. But here's the thing, and this really irritates me that this has persisted in orthopedic surgery and really all of medicine, this idea that arthritis and osteoarthritis is wear and tear. They talk about the tread on the tire is the analogy everybody uses. The problem is that's not what arthritis is. There may be a small component of that, but arthritis is an inflammatory disease. If you think it's a wear and tear thing, why do people that are way overweight that haven't exercised a day in their life and don't do physical work, why do they need hip and knee replacements? They shouldn't have any damage of their joint. It's because the horrible food they've eaten their whole lives and all the stress for whatever reason, and their joints are just filled with these inflammatory cytokines and degradative enzymes that just eat away the cartilage and bone. So the key is stopping that, and the exosomes are really a second phase of that, but it's stopping that inflammatory process. Yeah, it's things like supplements and medications that stop those cytokines and degradative enzymes, and healthier diet and exercise and all things that are good for cartilage. But then, treatment like PRP or like exosomes exosomes or injections like AOD 9604 that actually nourish and rebuild the cartilage. And so you have to attack it both ways. As far as when you do it, there's never a time that it's too late. It's just risk. Once you get to bone on bone, there's going to be a limited ability to sort of reverse that damage. So ideally, if you can get to people in their 40s and 50s before those knees and hips break down and start doing those treatments, you'll probably never need a hip or knee replacement. I strongly believe that. But in this country, we don't seem to value prevention. We don't pay for prevention. We just wait till it's a problem and then pay for treatment. But if you can do this kind of thing when you're really active before that cartilage and bones start to break down, that's the holy grail. We could probably prevent, if you really got to this early, I'm just guessing on a percentage, but a third, 40% of hip and knee replacements in this country. Wow. But we've got to have people that are willing to kind of look at this stuff when they're young. And that's a tough sell because, again, these aren't free. And so that it's a challenge, but it's really exciting. And I would say it's never too early, but it's also never too late. It requires a discussion with the provider about expectations, and maybe you tweak the protocols, what you use when a little differently.
I love that because I've been actually, I'm not going to lie, that question was kind of for myself. I'm not going to lie. That wasn't directly just for everyone else because I've been playing with it. I have a buddy of mine who does exosome therapy, and then I'm like, I'm going to go see Dr. Geier and go get some peptide therapy for myself, make sure preventative. Yeah. I'm 44 years old right now. Why not?
Yeah, believe me, I'm right there with you. I'm 48 and I lift weights. I just, in fact, started a new weightlifting program that is absolutely kicking my butt. I am so sore and have aches and pains and I told one of my partners that I really appreciate working here now because I can use this almost as a lab on myself. I'm like my own guinea pig. I haven't done exosomes yet, but I am actually about to start a medication, an injectable medication, because I do think I've got some early wear and tear in my neck. Mm-hmm. And, we know these are safe. It's just a matter of, figuring out kind of what works for you. But I use 3 different peptides and I'm a big believer in this, but I'll test it on myself and tell patients, hey, I use this too. Yeah. And they're not for everybody. I will say a lot of patients get nervous by the idea that it's experimental, and I lay out the research and all that, but I get the concerns. You want to stick to kind of FDA approved things. But PRP has been around for almost 2 decades now, and the FDA still hasn't approved it. Like, at what point do we wait and say, when every other country these things are legal and not here in the United States, do we say, you know what, we just got to be willing to try some of them? You never tell somebody that absolutely this is going to work. I promise. You can't do that with traditional medicine. But I feel like that a lot of these are worth a try, especially if you've tried all the other stuff, surgeries and cortisone shots and all this stuff, and you're not any better. Yeah. So I feel like that's where I fit in, and people like me fit in, where the traditional model, where it's not perfect for a lot of people.
I love this conversation so much. I just want to pivot just a sec, because I know you and I talked a lot about behavior and prevention, right? Like, where do you think the world is going and medicine is going with respect to behavior, behavioral health, and how people are using it? And my work is really, as you're aware, is really about behavior. It's about changing habits, about changing behavioral lifestyles, and rewiring the entire brain and nervous system to be able to create that. Where do you see the future of healthcare where it comes to behavioral health?
The behavioral world, behavioral science, behavioral economics is going to be such a huge part. It's already becoming a huge part of healthcare. Because, as I said earlier, information doesn't change people's behavior. I'm the medical expert on 2 TV stations here in Charleston, so I'm on TV every night on both of these stations, and I give information about COVID. I give information about nutrition, new studies on nutrition or exercise or all this. And I know that information very largely doesn't change what people do. I can give you a study showing how bad ultra-processed foods are. McDonald's is still the #1 restaurant in America. So we need the ability to have people make changes in their lives, to change their habits, to change their behaviors. But as you and I just talked about, doctors really, and not just doctors, lots of healthcare professionals across the spectrum of healthcare just don't have the time and ability to do it. So what I expect you're going to see are companies that have apps and have online platforms and health systems, the Mayo Clinics of the world, the Cleveland Clinics of the world, they'll partner with these apps, these health platforms, a little bit of what you're seeing even with the Apple Watch.
Yeah.
They'll partner so where the doctors will be able to give the information, but they'll use these apps, these services, these platforms to reinforce the behavior. And I actually feel like that's very exciting because you're getting people, doctors by and large don't know behavioral science. They don't know how to teach habits. They don't know, encouraging the fresh start effect so that people are more likely to complete a goal when they sort of start new. That's why New Year's resolutions are so popular. And there's all sorts of behavioral science, things, the licensing effect where you do something good, so you've earned the right to do something bad. Sure. There's so many behavioral science things that can influence your ability to achieve a health goal. Doctors generally don't know that. So partnering with these companies to really create a comprehensive model to change people's behaviors, I feel like is where we're headed. And to me, that's extremely exciting.
I think it is too, right? Like, in my world, as everyone here is basically in my world with respect to rewiring their brain and that. And I hope you guys are kind of getting what Dr. Geier is saying, is that your doctor, as much as you want to place your health inside of they're not trained on it. They're not bad people. They can only learn what they can learn. That's why I want everyone to gather, right? This program that you guys are in the Ultimate Rewire, this is about mastering all 7 areas of your life. And I've said to everyone on this call that whatever you don't empower, you're leaving for someone else to overpower. So if you keep yourself disempowered in an area, someone else is going to overpower you. Information is just the tip of the iceberg that opens awareness. Awareness is what allows you to take action and momentum and movement and create momentum inside of it. These are the steps that we do. And what we do inside of this, as you guys all know, is we actionalize the system. We get you to a point of gratitude and inspiration to actionalize and want to and love to create the actions instead of staying based in your amygdala that keeps you in a state of desperation of action. So, Dr. Geier, you are a breath of fresh air in so many respects, and I can't wait to come down to Charleston and get my own peptide injections because I'm all about it.
Yeah, I can't wait. And I applaud you. And I said before, there's people out there doing a lot of great things online and getting the word out. But I admire everybody that's participating in your program because this is the future. Whether it's you and me, this idea, this sort of movement is almost what I'd call it, is where we're headed. And I really feel like for the people that buy into this, it's their health and their life is going to just exponentially improve.
I couldn't agree with you more, Doc. Thank you so much for taking the time on your schedule to be here, to be a part of this. I know you're going away with for the family over the weekend. I appreciate you doing this early as a recording for us. It means the world to me. And I just want to thank you all. And from everyone on behalf of my community and my world and my office, my team, thank you for all of this and everything that you do.
Oh, I couldn't tell you how I so much appreciate it. This is so much fun. And I really am excited over the coming months and years finding ways to work together more because you and I clearly have a passion for helping people in a bigger way than just a one-on-one setting. And I just can't, I'm so happy that we cross paths and can't wait to keep working together.
Absolutely, my friend. I look forward to it. Thank you so much. Hey guys, if you like that video, click on the link over here and you're going to love the next video.